Have you ever dreamed of starting your own podcast? Well, you can. It's simple, it's easy, and best of all, it's free. By going to anchor.fm, you can start your own podcast today and have your own show up and ready to go. Anchor's graphic user interface is user-friendly, and you get paid for your content by setting up a Stripe account. Go to anchor.fm. Again, that's anchor.fm, and start your podcast today. Welcome to the Living Healthy Podcast, where you can improve your quality of life by making solid and informed decisions. I'm your host, Eddie Randall. Tonight's podcast is entitled Acid Reflux, the Silent Symptoms and the Risk if Left Untreated. Acid reflux is one of the most common problems in gastroenterology. Everyone can experience that problem every now and again. However, for some, it's a chronic issue. About 30% of the population suffer from this condition at one time or another. If left unchecked, this condition can lead to complications involving coughing, hoarseness, a hiatal hernia, throat cancer, and vocal cord cancer. This can happen when the stomach acid backs up into the esophagus. The lining of the stomach can handle this acid, but not the esophagus. Gastroenterology started as a specialty in the 1890s in Germany. Many U.S. doctors went to Germany to study, including Dr. Asher Wilkenstein. He founded the first gastroenterology practice in the United States back in 1935. His clinic opened in Mount Sinai Hospital in New York. He also was the first doctor to describe acid reflux and GERD. GERD is gastroesophageal reflux disease. He also linked it to acid contents coming up through the stomach. Acid reflux and GERD are not the same thing. I'll get into the differences a little later on in the podcast. Many people have favorite foods, and sometimes these favorite foods can cause acid reflux. In our society, we're simply told to take a pill and continue to eat our favorite foods that unfortunately cause acid reflux. As an example, many people like Mexican food, and unfortunately, it is a primary cause of acid reflux due to the spicy content in the food. Those pills that we take can cause major problems like respiratory infections, kidney failure, heart attack, and cancer. Those pills can also cause less serious conditions such as diarrhea, headaches, and lethargy. It would be better to avoid certain foods altogether if you suffer from acid reflux, or to just have those foods every now and again. Food releases neurotransmitters such as norepinephrine and dopamine, which can cause addictive behavior in relation to your favorite food. For this reason, it is easy for many of us to try to have our cake and eat it too, by continuing to eat things that cause us a medical condition and just simply take a pill to cover it up. Typical symptoms of acid reflux include chest pain and/or a burning sensation. Other symptoms include throat pain, burping, nausea, hiccups, and/or flatulence. There are several terms revolving around acid reflux, such as GERD, indigestion, and Barrett's esophagus, to name a few. These terms are closely related, but they do not all mean the same thing. Acid reflux is the condition where acid rises up into the esophagus, causing a burning sensation. This happens when the lower esophageal sphincter at the base of the esophagus, which leads into the stomach, relaxes, allowing acid to pass through and come up into areas where it does not belong. The lower esophageal sphincter normally acts to prevent food and stomach acid from traveling back up into the esophagus. Acid reflux can occur due to being overweight, being pregnant, laying down right after consuming a meal, smoking, as well as consuming spicy and high-fat foods. Acid reflux is normal on occasion. If it happens every once in a while, there is no need for concern. GERD is gastroesophageal reflux disease. The difference with this and acid reflux is that GERD is the more serious and severe chronic form of acid reflux. This condition is reason for concern, as the stomach acid can travel into parts of your esophagus and cause damage and can even affect your vocal cords. This condition can cause hoarseness, coughing, bad breath, and in worst cases, cancer. Barrett's esophagus happens when there is repeated exposure to the acid that's supposed to be in the stomach. The esophagus can become inflamed and have a change in texture, which can develop into cancer. A change in cell tissue texture is normally referred to as dysplasia. MayoClinic.org states that ordinarily the esophagus will appear pale and shiny, while a person with Barrett's esophagus will have an esophagus that looks red and will be thickly textured. They also state that there are 2 levels of dysplasia which can occur. This is very important to monitor and to eat foods that agree with your body, as upon reaching the 2nd level of dysplasia, which is termed high-grade dysplasia, the next step is unfortunately cancer. Indigestion, also known as dyspepsia, is the feeling of pain or fullness or heartburn. This is a symptom of a gastro disorder such as acid reflux, GERD, or Barrett's esophagus. Indigestion can also be a symptom of other GI issues such as ulcers or gallstones. It's vital to pay attention, as this symptom can unfortunately be confused with gas or an impending heart attack. If there is pain in the chest, it can often radiate into the back or arm. Seeing that these symptoms are similar to myocardial infarction, you have to listen to your body and seek medical attention depending on the severity of your symptoms. Heartburn is the burning feeling of the acid escaping the sphincter at the stomach and traveling into the esophagus. This is most often associated with a sour or bitter taste. Heartburn is a symptom of acid reflux, and chronic acid reflux, as I stated, is referred to as GERD. I will now discuss a few other symptoms that can be associated with acid reflux. Although they can be problems associated with other GI issues, they can be a common result of having acid reflux. A hiatal hernia is when part of the stomach pushes through the diaphragm. This can be caused by trauma, like playing a contact sport, a car crash, or a fall. However, the most common cause is from an increase in pressure in the abdominal cavity, i.e., from being overweight or being obese. When a hiatal hernia forms, the result is a little pouch where stomach acid, which is a combination of gastric juices, hydrochloric acid, and digestive enzymes, can enter. The final result is heartburn and GERD. Now, there are 2 types of hiatal hernia. The most common type is the sliding hernia, where a portion of the stomach pushes through the diaphragm. On the Medical College of Wisconsin's website, they state that 1 in 4 adults has this type of hernia by the time they reach the age of 40. The second and least common type is called a fixed hernia or a paraesophageal hernia. This is a more severe type, which can result in ischemia and a bowel obstruction. This type of hernia happens when the stomach pushes through the diaphragm and stays there. This is very dangerous, but thankfully it's very rare. The next condition or symptom is dysphagia. Dysphagia is difficulty swallowing and or experiencing a choking sensation. This can be caused by GERD, where the repeated exposure to acid irritates the throat, causing scar tissue to develop, resulting in difficulty swallowing. This condition can result in unwanted weight loss, chronic bad breath, throat pain, as well as chest pain. A peptic ulcer is another common cause of acid reflux. A peptic ulcer can form when the lining in the stomach or the duodenum becomes irritated or inflamed. This can happen from a bacterial infection like Helicobacter pylori, or inflammation that comes from taking over-the-counter medications like aspirin or Tylenol. On clevelandclinic.org, they state that the normal layer of mucus that protects the stomach from stomach acid can become reduced, leading to a peptic ulcer. This is why when you read labels on medications, it says to eat with food, because the churning of stomach acids and activation of digestive enzymes will stimulate digestion and help to dissolve the medication quicker than just by taking a solitary pill and having it sit in your stomach and dissolve slowly. This can unfortunately lead to some irritation. Research has shown that in some individuals, medication taken alone may upset the stomach, so manufacturers are just covering themselves. This is why it's important to pay attention to your body. Symptoms are often our check engine light. Acid reflux can be the cause to many underlying ailments such as ulcers and other GI conditions such as gastroparesis. Gastroparesis is the paralysis of the digestive system, which has the propensity to cause acid reflux as things can get backed up. This happens when the vagus nerve becomes damaged. The vagus nerve is responsible for helping to move food into the digestive tract. What I didn't know is that it can be damaged by diabetes. I always knew that it could be caused by other stomach disorders, but according to Cleveland Clinic website, long-term diabetes is the primary cause of gastroparesis. There are tests like gastric emptying tests that can be done to help determine if an individual has this condition. Acid reflux can be a sign of other conditions as well, such as cancer. This is why it's important to pay attention to your body. Acid reflux every now and again is a normal condition. It's the chronic acid reflux that is need for concern. Prevention. Prevention of acid reflux can be done by paying attention to the foods that cause the symptoms, and we can also monitor this to make sure we avoid those foods. The hard part is that most of these foods, whether it's spicy food or coffee, these things can be part of the favorite foods that we love to consume, and it would be hard-pressed to break habits and give them up. Food is addictive, and we can develop addictions through the dopamine reward pathway, especially when society is telling us to go after what we want and to take what we want, and if there are any symptoms or problem, to simply pop a pill. That may not be the best solution for the problem, as many of these prescription medications and over-the-counter medications are not a long-term solution. Short-term, they're necessary and they do their job and they work fine. However, long-term, some of these medications can cause issues such as kidney damage, liver damage, and even dementia. I'll discuss these further on in the podcast when I get to cures and medications. Another thing to do is to have smaller meals. Smaller meals can help by putting less stress on the stomach. When we eat a large meal, the lower esophageal sphincter can relax, which will allow the acid to travel back up. Smaller meals can put less demand on the stomach, allowing the sphincter to relax less. Also, drinking a glass of water after a meal can help to dilute the stomach acid and alleviate symptoms. Eating a few hours before bed or having midnight snacks is simply out of the question. Gravity will not be our friends in situations like these, and it's best to avoid eating food late at night anyway. The most common foods that cause acid reflux are high-fat foods like fried chicken, French fries, fried shrimp, hamburgers, pizza, wings, barbecue, lasagna, chili, spicy South American dishes, pretty much all the things that taste great. Other things like tomatoes, ketchup, spaghetti sauce, chocolate, and peppermint are also culprits for causing acid reflux. Beverages on the high acidity list are milk, alcohol, orange juice, lemon juice, grapefruit juice, soda, carbonated energy drinks, coffee, and green tea. For most people, this is normal everyday food. For others, they are seldom indulged guilty pleasures. At this point, people are probably wondering, what are you supposed to eat? Don't get me wrong, you can eat these foods, but you have to eat them in smaller amounts and to eat them in moderation. I know it's hard to say, especially for me, as I love coffee. I have coffee almost every day. I also have acid reflux every now and again. Loose clothing is also advised, as tight-fitting clothing can worsen the symptoms by putting pressure on the abdomen. Acid reflux happens because high fatty foods as well as acidic foods and beverages tend to stay in the stomach longer and delay gastric emptying. In addition, fatty foods relax the lower esophageal sphincter, which allows the acid to travel back up into the esophagus. I wanted to take a moment to say thank you for supporting the podcast. The Living Healthy podcast is listed on many platforms, including Anchor, Amazon Music, iHeartRadio, Google Podcasts, Spotify, Bullhorn, and many others. You can follow me on Twitter, Instagram, and Pinterest. And don't forget to check out the Living Healthy podcast channel on YouTube. Also, if you have any questions or would like me to discuss a particular topic, or you'd like to be a guest on the show, please contact me at livinghealthy@gmail.com. Heredity. Acid reflux can be hereditary. This concept has been gaining traction in research studies. If you think about it, it makes sense because you can inherit behaviors, traits, and predispositions. You can inherit cancers, your grandmother's gait, and your father's bushy eyebrows. An article by Argaru, Legaki, Contempspras, and others called Risk Factors for Gastroesophageal Reflux Disease: An Analysis of Genetic Contributors. They state that genetic factors play a major role in GERD and related disorders. Studies have been shown that 31% of cases studied were inherited. There are other factors like obesity and diet that can bolster these chances and/or make symptoms worse. Stress and nervousness. Stress, anxiety, and nervousness can cause acid levels to rise, leading to acid reflux and GERD. Also, if the person already has acid reflux, stress and anxiety can make acid reflux worse. Much like tight clothing, increased pressure from stress can put excess pressure on the abdominal wall, leading to pressure on the stomach and loosening of the lower esophageal sphincter. There's an article called Association Between Anxiety and Depression and Gastroesophageal Reflux Disease, results from a large cross-sectional study. It is by Choi, Yang, Kang, and several others. Their study involved 19,099 people, and their results determined that people with anxiety were more likely to have or develop GERD. Acid reflux and age. Age is also a factor when it comes to acid reflux. The majority of people, I'm sure, can remember when they could eat anything, and regardless of the time of day or night, they could go to sleep right after and there would be no heartburn. Acid reflux tends to get worse as people age. It is commensurate in that a slower metabolism allows weight gain, which, as I stated previously, puts pressure on the stomach and the lower esophageal sphincter. However, in the United States, it appears that people of all ages can get acid reflux. Although heredity and obesity are precursors for preteens and teenagers, some physicians are treating infants for acid reflux. I do not agree with this at all, but it appears that when some parents, and I believe that they're probably brand new parents, see their child spit up and cry, they believe it is that the child has acid reflux. On top of this, some doctors are actually prescribing medications to treat it. It is natural and normal for a child to cry, and natural and normal for a child to spit up. Babies have been doing this since the beginning of time. On abcnews.go.com, there's an article by Michaela Conley called "Too Many Babies Receive Acid Reflux Meds," says pediatrician. She spoke to pediatrician Dr. Eric Hassel, who stated that babies will be babies and they will cry and spit up. He went on to say that some doctors are complying with parents and simply giving them what they want. He also mentioned that there has been a drastic increase in acid reflux medications being prescribed to children. Personally, I think this is horrible, but in American culture, especially with younger generations, they're being conditioned to embrace convenience, no discomfort, and with a I want it now mentality. I'm not beating up on anyone or pointing fingers. You can't really blame someone when society is continuously telling them that things should be easy and convenient. As far as acid reflux in infants, just being human, there's a chance that an infant could have it. However, significant testing should be done as to not misdiagnose the child, because a baby spitting up and crying, again, is 100% normal. Treatment. In order to treat acid reflux, it first must be diagnosed. Oftentimes, H2 blockers or proton pump inhibitors will be prescribed by a PCP. H2 blockers reduce stomach acid, and they work by binding to active sites that prevent pepsin, a digestive enzyme, from being produced. The result is producing less stomach acid. Proton pump inhibitors work similarly by blocking hydrogen potassium adenosine triphosphate. This chemical lines the cells of the stomach and produces stomach acid. In severe cases, or if symptoms do not subside, the patient may be referred to a gastroenterologist. The aforementioned medications dosages may be increased, and or an EGD or esophagogastroduodenoscopy would be scheduled. This is when they put the tube with the camera down your throat to look around and check for damage from stomach acid. A biopsy could also be done at this time if it's necessary. The EGD is how a hiatal hernia and Barrett's esophagus are often diagnosed. Your doctor may also recommend exercise and diet for weight loss in order to take the pressure off of the stomach. Acid reflux can actually be cured through diet, exercise, and lifestyle change. Exercising and avoiding the foods that give you the acid reflux can alleviate and eventually cure this illness, unless there is a specific medical condition that warrants you to have continued use of proton pump inhibitors or H2 blockers. They should be avoided in regard for long-term use. Medications are a temporary fix in a treatment plan to allow healing. The thing is to follow your doctor's advice, though, regarding this condition, but essentially, depending on the stage that you catch the acid reflux, you can pretty much treat it on your own. Medication for acid reflux. In regard to the H2 blockers, some of the most common H2 blockers are Zantac and Pepcid AC. As with all medications, some H2 blockers have side effects, such as constipation, tinnitus, dry mouth, headaches, urinary problems, pancreatitis, kidney problems, and cancer. For proton pump inhibitors, some of the most common types or common names are Nexium and omeprazole. Side effects from proton pump inhibitors include diarrhea, constipation, kidney disease, C. diff, and dementia. This is why we should do our best to alleviate acid reflux by avoiding foods that cause this condition and do our best to lose weight. Medications are necessary, but long-term, these medications, as well as all medications, can actually end up doing more harm than good. The Washington University School of Medicine in St. Louis published an article on their website by Christina Saraween. It's called Heartburn Drugs Linked to Fatal Heart and Kidney Disease, Stomach Cancer. The Washington University School of Medicine published a study that showed that proton pump inhibitors cause cardiovascular disease, kidney disease, and upper stomach cancer when used long-term. Natural cures and alternative medicine. Now, taking baking soda, aka sodium bicarbonate, can be an easy natural fix out every now and again for acid reflux. Just take 1 to 2 teaspoons per glass of water for the condition. Drinking water, which is not as effective as the baking soda, can also be helpful. So I encourage you to drink a couple of glasses of water after a meal if you feel acid reflux is coming on. And if that works for you, then I advise that you continue it. However, more than anything, seek advice from a doctor. The next thing I'll talk about is a little interesting. Apple cider vinegar for acid reflux. Some people will think that apple cider vinegar is acidic, which is true, and adding more acid to an already acidic environment will also exacerbate the issue. Well, that is 100% correct. When using apple cider vinegar, where it comes into play is if you are self-diagnosing at home when you have acid reflux. A lot of people will say, try this and see if it works. The reasoning behind this is that low stomach acid can also cause acid reflux. However, this is only the case if you have hypochlorhydria, which means your stomach produces low amounts of stomach acid. If your stomach produces low amounts of stomach acid, then it will put pressure on your stomach as it tries to produce more, which would send acid up into the esophagus where it does not belong. However, the majority of people will be fine using baking soda and water. This is because if you have low stomach acid, aka hypochlorhydria, then you'll have a lot of other issues as well, such as vitamin B deficiency. Low stomach acid will result in you not being able to digest important nutrients, minerals, and vitamins. So it will actually lead to a lot of other imbalances and disorders in the body. So unless your blood work is out of whack and or you're feeling fatigued and notice changes in the body, then baking soda will be sufficient for your acid reflux. The baking soda would work fine as a temporary and natural way to curb it. As always, go to your PCP for full blood workup and evaluation based on the conditions you are experiencing. Since anxiety can cause this issue, prayer, meditation, deep breathing, listening to classical music, and yoga can be used to alleviate the symptoms. Stress can cause the heart to race, muscles to tighten, as well as shortness of breath. This can end up causing acid reflux, and these are simple and effective ways that you can try to alleviate or eliminate the condition. There are also videos and MP3s online of rain and thunderstorms that you can watch and listen to, as there are a lot of research out there showing that these videos and MP3s have a calming effect when you listen to them. In addition, if you feel a bout of reflux coming on, you can also eat a banana. Not only is a banana non-acidic, it's nutritious and good for you, it can also coat the esophagus, making it feel better. Foods to avoid. Foods to avoid that cause acid reflux are the following. I mentioned most of these earlier, and I'll just do a quick review. Ketchup, cheese, pizza, spaghetti sauce, chocolate, lemons, tomatoes, French fries, spicy seasonings, peppers, raw garlic, onion rings, ham, bacon, and pork. Drinks to avoid would include soda, orange juice, grapefruit juice, and alcohol. Foods you can eat. The following are just a few of the foods that you can eat that you can have to avoid getting acid reflux or just alleviating the symptoms. This would include baked chicken, baked and broiled fish, watermelon, avocados, rice, potatoes, lentils, honey, and leafy greens. Well, this is going to do it for this episode of the Living Healthy podcast. I want to thank you for listening. I want to thank you for your support, and I'll see you next time. And remember, living healthy creates a better you.